Antisocial personality disorder is a chronic mental health condition, informally known as sociopathy. It is characterized by a disregard for the feelings and rights of others. Some people seem to have no regard for others and can cause harm to them without any regret or feelings of guilt. When this behavior is pervasive, a person may have a chronic mental health condition known as antisocial personality disorder. Sometimes people with antisocial personality disorder are called sociopaths. What is a sociopath? People with antisocial personality disorder are willing to use deception or manipulation to get whatever they want, such as power or money. They may con people and use an alias, and they may steal or use aggressive behavior to achieve their desires. Even when caught, they show no regret or guilt. They lack a sense of empathy and cannot consider the feelings of others without help. They also tend to act impulsively, which can lead to arrests and time in prison.
There is a common myth in popular culture that sociopaths tend to be successful, charismatic people who hold positions of power. It is true that there are high-functioning sociopaths, but they are not the norm. While sociopath traits can include persuasiveness or charm, most people with the disorder will struggle with irresponsibility. They're less likely to take advantage of employment opportunities, less likely to pay bills on time, and are at high risk of incarceration due to impulsive behaviors. They're also likely to have a shorter life expectancy due to impulsive behaviors like substance abuse and criminal activity. What causes antisocial personality disorder? Researchers believe that genetics plays some role, as having a parent with the disorder puts one more at risk. Research on adopted children of parents with the disorder indicates that environment may also be a factor, such as when children receive poor discipline, have negative role models, or are not taught to respect the rights of others. Children of an alcoholic parent are also at increased risk.
Children who have conduct disorder or attention deficit, hyperactivity disorder before age 10 are at increased risk for having antisocial personality disorder as adults. This is particularly true for children with conduct disorder who are abused or neglected. Researchers estimate that 25% of girls and 40% of boys with conduct disorder will have antisocial personality disorder as adults. Antisocial personality disorder occurs in roughly 3% of the US population. The disorder occurs in men 6 times more often than in women. 80% of people with the disorder will have developed symptoms by the age of 11. Symptoms of antisocial personality disorder. The most common signs of antisocial personality disorder are a lack of regard for the rights of others and an extensive pattern of violating them. To receive a diagnosis of antisocial personality disorder, a person must exhibit at least 3 of the following symptoms: repeatedly performing unlawful acts, lying or conning others for profit or pleasure, acting impulsively, repeated physical fights or assaults, disregard for the safety of oneself or others, irresponsibility at work or in financial obligations, lack of remorse when mistreating others.